I'm David Adams. It's my great pleasure to welcome you to the 5th ATS Mitral Conclave.
Hi, I'm Dr. Randy Martin, and I'm thrilled to be joined by Mike Mussalem. Mike, you're CEO of Edwards, as we all know, and you know Edwards has been a tremendous supporter of, I think, of professional education and developing a real collegial relationship. Tell me a little bit about how that came about, or why that's so important.
Yeah, you know, for me, it's one of the most fundamental things that happens across medical technology, and probably no better example than the history of Edwards. If it goes back to the very birth of the company, it's always been this partnership between clinicians and some bright technical folks that have solved some of the toughest problems in cardiovascular medicine. And we've been so fortunate to have these incredible relationships over the years, and so much important innovation continues to come from this. We kind of consider it part of the secret sauce if you're really going to change the way medicine's practiced, to have this collaboration that's really positive.
You know, it's interesting because in my area of ultrasound, of echo, we did the same thing early on, and then as all the conflict of interest stuff came in, there was a little bit of a barrier, but that's the way I think real advances are made, doing exactly what you all are doing.
Yeah,
get your engineers and your clinicians and scientists together.
Sure, the conflict of interest concerns, those are natural, and those are well understood, and patients want to feel like someone really has my interest at heart. But if they could see the interaction of physicians and industry working together to solve problems, they would smile, because so many good things come from it. I think of a history of incredible innovations that have come because of it, and when I think about the future, I get even more optimistic about it.
I'm going to come back to the future in just a second, but you all have been tremendous supporters of physician and consumer education, but especially physician education. Why is that so important?
Well, I mean, frankly, you really can't have impact on medical care unless you're able to have something that's generalizable, and to be able to create educational opportunities where physicians can learn from each other and be able to practice expertise in their own community with their own patients. This is when the magic happens, and this is when you can really take a bright idea and have it spread across the globe and have a highly effective education where people really learn, and learn the right way is something that we're believers in. So, I mean, it's part of the formula if you're going to be successful at what we do together, which is to create great evidence that says, no, this works if you do it the right way, and then to be able to have generalizable procedures and tools that help guide you through that. So that's really a critical element of having something have big impact for patients.
Your company has really been based also on innovation. You mentioned that, and I mean, I look back and I think, in the late 60s and early 70s, when I was a house staff at Stanford, and aortic valve surgery was there and big thing. None of us would have ever envisioned the TAVR story, but all the innovations. How do you, looking at where we're going with structural and valvular heart disease, what do you see as the innovation of the future?
So for me, I think we're entering a golden age. We've learned so much over the years about how to treat structural heart disease, and historically, we look back now, and these incredible innovations now look kind of crude to us, right, in terms of what's possible in the future. What kind of tools are we going to be able to apply to this that help a patient with a quicker recovery, be able to get back to their life? And as good as our therapies are, let's take, for example, this mitral beating and so forth, as good as they are, a small percentage of patients really come in that deserve to have it get treated and get treated when they should, right? And so we have big work to do. And I think the more we can create really safe procedures that are highly effective, where a physician can look in a patient's eyes and say, I'm not going to make you worse if I have a great chance of making you much better. Let's do this. You should do it now. That's what we need to strive for.
And you all are pushing forward, not only in your bread and butter of surgical approaches, but obviously transcatheter. Yes. That's going to be a big play, don't you think, in the future in structural disease?
I think transcatheter is going to be really important. Things that were only possible in an open chest in the past, I think we're going to be able to do by catheters in the future, and we're able to do small miracles on the tips of catheters that we never dreamt about in the past. But having said that, I also think that surgery is going to have a bright future. It's just going to be really different. Matter of fact, I think about the surgeons of the future and the very difficult problems they're going to be confronted with. They're going to need support, and we're committed to be there. Yeah.
Well, Mike Edwards has been really such a stalwart and a shining light, I think, in relationships with physicians, education and innovation, and all of our patients. I've had family members that benefited from that, so thanks very much.
Yeah, thanks.
Appreciate it.
My pleasure. We're committed.
Thank you. Thanks,
Randy.
And thank you for joining us.